Good evening, everyone, and welcome to the Syrian-American Medical Society's 2019 Annual Report Webinar Launch event. My name is Omar Offendum. It is a pleasure, it is an honor, it is indeed a responsibility to be here with you all this evening. I am so excited to be hosting and introducing you to a phenomenal array of speakers, medical health professionals working in the field in Syria and here in the United States who will be telling us about the impact that the year 2019 had on so many people who truly deserve and need this assistance and this aid. The Syrian-American Medical Society was founded in 1998 in the United States as a professional society to provide networking, educational, cultural, and professional services to medical professionals of Syrian descent. SAMS Foundation, the charitable arm of SAMS, was launched in 2007. And since then, SAMS has become one of the most active and leading medical relief organizations that is working on the front lines of crisis relief in Syria, neighboring countries, and beyond. Since 2011, SAMS has provided nearly 20 million medical services to those impacted by the conflict, delivering over $207 million in humanitarian aid. A phenomenal feat indeed. And to learn more about that, make sure you visit sams-usa.net. where we just launched the 2019 annual report. Now, to set the stage for this evening, I thought it would be fitting to recite a poem by one of my biggest inspirations, Khalil Gibran, who wrote about 100 years ago, a poem dedicated to young Americans of Syrian origin, in which he said, "To young Americans of Syrian origin, I believe in you and I believe in your destiny. I believe that you are contributors to this new civilization. I believe that you have inherited from your forefathers an ancient dream, a song, a prophecy, which you can proudly lay as a gift of gratitude upon the lap of America. I believe that you can say to the founders of this great nation, here I am, a youth, a young tree whose roots were plucked from the hills of Lebanon, yet I am deeply rooted here and I would be fruitful. And I believe that you can say to Abraham Lincoln, the blessed Jesus of Nazareth touched your lips when you spoke and guided your hand when you wrote, and I shall uphold all that you have said and all that you have written. I believe that even as your fathers came to this land to produce riches, you were born to produce riches by intelligence and labor. I believe that it is in you to be good citizens. And what is it to be a good citizen? It is to acknowledge the other person's rights before asserting your own, but always to be conscious of your own. It is to be free in word and deed, but it is also to know that your freedom is subject to the other person's freedom. It is to produce by labor and only by labor, and to spend less than you have produced, that your children may not be dependent upon the state for support when you are no more. It is to stand before the towers of New York and Washington, Chicago and San Francisco, saying in your hearts, I am the descendant of a people who built Damascus and Byblos and Saida and Sur and Antakya and Idlib and Hama and Halab and Homs. I added those in. And I am here to build with you and with a will. It is to be proud of being an American, but it is also to be proud that your fathers and mothers came from a land upon which God laid his gracious hand and raised his messengers. Young Americans of Syrian origin, I believe in you. And I believe in you, and so do the thousands of medical professionals of Syrian descent in this country, of whom we are so proud. And so I would like to begin by introducing our first speaker, our first panelist, Dr. Maher Azzouz, who is currently the chairman of the SAMS Foundation and is a gastroenterology specialist in Westlake, Ohio. Dr. Azzouz, welcome.
Thank you, Omar.
Thank you.
This poem is very touching, and Gibran is obviously an inspiration, not for the Syrians only or Lebanese only, but for humanity. He had touched all of us with his humanity first, and to know that he has singled out Syrian Americans, just as you just outlined, is definitely a breath of fresh air in these tough times.
Indeed.
I want to thank everyone who put this activity together, and thank you for inviting me to participate in this webinar. First, as we discuss the launch of our annual report for 2019, I have to say that I need to pay tribute to the leaders of the organization that had preceded our team here. We start with Dr. Sahlul and Dr. Tarakji, who were the past presidents of the organization. We also pay tribute to Dr. Abdurrahman Zanabli, to Dr. Majd Isrib, and to Dr. Amjad Ras, who had filled the position that I currently fill as the chairman of the foundation.
Wonderful. Thank you for highlighting those important figures and their contributions. And I'd like to ask if you could give us perhaps an overview of the Syrian-American Medical Society's 2019 highlights. I know it was a challenging year for humanitarian and healthcare actors in Northwest Syria, from bombing to waves of displacement. How did SAMS manage to overcome these changes, or these challenges rather?
So obviously the 2019 achievements are a continuum of our work and our achievements over the last few years since 1998 when the organization was started. But obviously since 2011, the medical relief component took a center stage, and that's where we are most proud of. But before I start talking about SAMS, I have to pay tribute and thank to everyone who had made it possible for the leaders of this organization, including the previous boards, the current boards, the staff, the phenomenal teams in our regional offices. But we could not have done this without our donors. And our donors are a big group. The first group that I will pay tribute to is every member, every person who had donated to SAMS. That's what created the foundation. That's what had created the platform that allowed us to expand to where we are now. If it's not for the generous donations of each individual that supported SAMS in the beginning all the way until now through these tough times, that we see how donations have dwindled due to multiple reasons, but our supporters, our members, our donors have continued to support us and allow us to provide this phenomenal service. Those members, those donors, are the ones who allowed us to create the setup for which now we depend on the generosity of the countries that support us. A big component of our support comes from the generosity of the countries and the donors, whether countries, foundations that are supporting our work at this point. And I would list multiples, including obviously the government of the United States through the State Department and USAID, Germany, England, Netherlands, and of course France, in addition to multiple others like Luxembourg and Netherlands and others. Without those structured support through grants and program support, we could not do what we're doing now. But again, the unique thing about SAMS and what provides SAMS with its resilience and ability to adapt to the challenges that we faced, not year after year, month after month, but day after day. We could not do this without the support of our members and our generous donors. From the $100 donation to the $1,000 donation to the $5,000 donation, those make a big difference. That's what allows SAMS to have its resilience, its adaptability, its flexibility, to be able to fill in the gaps that we have witnessed, obviously, within the international medical relief system. While SAM's focus has always been on beneficiaries, meaning our patients, the services that we provide across the region and in the US, the services that we provide mainly in Syria, but also in multiple other countries, including Jordan, Lebanon, Turkey, Greece, Iraq, Bangladesh, and others. We could not do this without this support. But SAM's focus has always been on quality before quantity. While we are very proud that if you look at our annual report, we have continued to grow in the number of beneficiaries. But also what SAMS brings to the table is the focus on quality and monitoring. And again, like I said, while our focus is beneficiaries and providing medical relief and medical services, but within our vision and within our mission, we focus on multiple other goals, including education, including advocacy, including research, again, with the focus on quality and providing a dignified healthcare. Those are the two elements that guide our work and that are the litmus test for any service or any help that we provide. Our work in education is growing. It is something that we put a lot of effort on, and we have very kind of shiny examples of programs that deliver, again, the dignified care and would focus on quality. I would focus on our midwifery school that provided quality graduates by all standards, that has been witnessed and supported by international donors and by our members and our phenomenal staff. Our focus on mental health education, where we're hopefully expanding, that would be our next frontier, is education when it comes to mental health. But we also support students and residents, as you will see, students that are continuing their education, trying to make sure that we focus on capacity building for the future. Although our vision and our mission focus on providing medical relief with quality and dignity at this point, but our bigger goal is the future, is being an important player in the future of healthcare in Syria, in the future of medical education in Syria, in addition to expanding our role globally and obviously in the US, where we are an integral part of the healthcare system. The other point that SAMS focuses on is research. And research in the sense of documentation of the events, documentation of the sacrifices, documentation of the experiences that we've had as we have led this medical relief work. Documenting these experiences with their successes, with their failures, with their challenges, it's extremely important so that we provide the whole world and the future of international medical relief with lessons learned from the Syrian conflict. Again, I have a special interest in mental health, and I always end up kind of focusing on mental health and the importance of mental health. And SAMS in 2019 has had multiple successes when it comes to mental health services that we provide regionally, not just inside Syria. But one of the things that we are proud of in 2019 is that we have achieved one of the WHO goals of what they label as integrated mental health services. And we have advocated for this, meaning integrating mental health services within the definition of primary health services. Primary health services include vaccinations, include new maternal help, include primary care help, but we've advocated and we have pushed, and I would say that at this point we are proud to say that our facilities inside Syria have integrated mental health services through our service line. So any facility does have access to a referral system and mental health services. Obviously, this is just the beginning, but this is something that we are very proud of. The mental health role also expands to refugees, expands to our approach to our services in the sense that we believe in the community approach to medical relief, meaning that when communities are hosting refugees, we approach medical relief in a community sense, meaning the whole community that the refugees reside within, not focusing on the refugee only, but the community that's hosting the refugees, so that the standards that are provided to the refugees are also provided to the community in general. And this is important so that refugees are not looked at as a liability, but as an asset to any community that welcomes refugees. And in 2019, obviously, refugees issues internationally became a big concern for any country across the globe, as we all saw. But as we have done this, again, 2019 continued to present significant challenges. Those challenges, some of them are new, some of them are old, but again, SAM's resilience and adaptability had allowed us in 2019 to be able to continue to provide the services, continue to grow, continue to increase our beneficiaries in number and quality of services that are provided. Those challenges obviously are many, COVID being the last but not the least. But we continue to have attacks on healthcare facilities and healthcare providers to be a significant challenge. In 2019, we've had more than 79 attacks on healthcare facilities. That obviously put us in a significant disadvantage. But with the commitment, skills of our staff on the ground, of our regional teams, we were able to continue to provide millions of services to our beneficiaries. And again, we could not have done this without the support of our donors, whether they are institutions, governments, individuals, or foundations. We are very proud of the foundation support that we have taken. And I would highlight the Schooner Foundation that has been a very generous supporter as an example of our US base that is expanding. The Schooner Foundation had been a generous supporter and we've enjoyed our partnership in the sense that we don't look at Schooner as a donor, we look at them as a partner. They are involved in focusing again on our goals, which are quality and dignified healthcare delivery. Other challenges continue to be present, including the red tape, including the difficulties with the international humanitarian relief structure. And that's where SAMS shines, where we can fill in those gaps in international medical relief. But obviously still, there are many challenges. Most importantly, and the most distressing, is weaponization of healthcare and humanitarian relief. That continues to be a challenge that we address through our fourth pillar, which is advocacy, that Dr. Mufaddal will probably talk about a little bit more. But during our growth, we continued in 2019 to focus on our regional growth in addition to our global growth. SAMS has a few years ago created its SAMS Global Response team and services so that the lessons that we are learning from our medical relief work in Syria, we can share those lessons with other areas of conflict across the globe. We are also expanding in the US, where our SAMS Community Outreach Program has also made significant strides in 2019, including supporting free clinic services in the US, and most importantly, and I'll touch on that a little bit later, is the support of our response, as we are an integral part in the healthcare response to COVID-19 in the US. We are expanding through our education by making sure that any education we provide to our members, to our teams in the ground in Syria, are actually provided with a regional approach and a global approach. So those educational services are provided to not just areas that we provide services in Syria, but all across Syria, all across the region, in Lebanon, Egypt, and most recently Yemen, Bangladesh. But as you see in some of the slides and some of the numbers that you will see, I will not go over too many numbers, because these numbers are covered within the annual report. But it is a source of pride for us to say that we have provided 2.5 million services in 2019. That is something that we are most proud of, and you'll see us repeating this over and over. But more importantly in 2019 is that so services, as you see in the annual report, are changing, where they're not just primary or emergency services, they're expanding into more of quality services, specialized services, like our cancer center in Northwest Syria, for example, like our cath lab and cardiology services that we are trying to launch in Northwest Syria, multiple other initiatives, including mental health. But again, if you look at the services, you can see how much more we are moving towards expanding in the sense of quality services and specialized services. The beneficiaries that we help serve in Northwest Syria, for example, have expanded significantly in 2019 with the addition of 1.9 million internally displaced individuals. This is a huge number. And this is more kind of dramatic when you look at the composition of that number and you find out that 51% of those individuals are children. 51% are children. The last thing that I would say is that it also speaks, that's the last sentence, to the resilience of SAMS and adaptability, is that when the crisis hits and when we see gaps, even in areas that are outside of our mandate, meaning in areas like humanitarian relief, where there is a gap, SAMS also steps in. So when there is a storm, when there is a humanitarian crisis, SAMS stepped in with supporting shelter programs inside Northwest Syria, in providing food, in providing health kits, in providing sanitation kits, and obviously our COVID response at this point.
Thank you so much for that recap, Dr. Maher. And I think it's just a testament to the resilience of the incredible staff and supporters of SAMS, and of course the donors, as you mentioned. And so for folks who are watching, just wanted to make clear, you can donate by texting to SOS for Syria to 91999. Text SOS for Syria to 91999 to make a donation. And now, thank you, Dr. Maher. I'd like to introduce a shorter version of our impact video for 2019 so folks can see firsthand some of the things that you were describing. Really incredible thing to see firsthand just how much of an impact this can have on the lives of people all around the world, but obviously in a place that's been hit with such a staggering amount of trauma and crisis, over and over again, and to still see the resilience and the smiles in people's faces is very inspiring. And I have to say, as somebody who has spoken at and performed at, had the privilege of speaking and performing at a number of Syrian-American Medical Society fundraisers over the years, it brings me great pride to see just how connected this community is globally. And so thank you again, Dr. Azzouz, for taking us through that recap of 2019. And it's my honor to now introduce our next speaker. Dr. Mufaddal Hamadi is the president of the Syrian-American Medical Society. Having assumed the position in July of 2019, he is a board-certified oncologist. He's also a clinical associate professor at the University of Illinois in Chicago and operates his own private medical practice, living in Chicago with his wife, his 4 daughters, and a really, really cool Harley Davidson. Dr. Mufaddal Hamade, welcome. Thank you for joining us.
Hello, hello, hello. Speaking of pride, I'm really, really proud of you, Omar. You're a great Syrian-American artist.
Thank you.
I follow you, and I'm very proud of you, and I'm proud of your work. And
thank you so much.
I'm very happy to see you here.
I'm happy to be here with you. This is as close as we can get. I'd rather be in Chicago with you, but this is as close as we can be. So, you know, I know SAMS has over 1,500 members across the U.S. and abroad. If you could tell us a little bit about the work of the society and how people can get involved.
Well, you know what? Maher spoke a lot, and thank you, Maher, for the great presentation you gave. You really covered everything. He talked about the fact that we have a lot of donors, and our donors, how important they are for the function of our society and what we do. But, you know, our donors mostly are our members too. And I feel that there is a far more important thing than donation that our members provide, which is being involved, being inspired by SAMS and inspiring by the work they do too. I think that what SAM's story is nothing but amazing. It is a story of a society that started in 1998, as you all know, and then it's a small society. It's a social club. And then the foundation was started in 2007. I was one of the old guys that started the whole thing. But then I got turned off by SAMS because it started actually to lose its mission. It started to become more aligned with, you know, the regime and things. So eventually, you know, when the war started in Syria, and then we decided to become more of a humanitarian organization, provide the humanitarian services, and the rest of history, you know, and between, and you know, in 2011 when we started, our budget was $750,000. Our peak budget was $42 million in 2017. So we have grown tremendously. Why did we grow that much? Because our work inspired the Syrian-American community. It inspired the Syrian-American doctors. They have seen palpable results of their work. And most importantly, they were involved themselves in that work, whether it was on medical mission, whether it's providing teaching to the people inside Syria, whether it's donating, whether it's you know, visiting the refugee camps. There were so many, you know, they were involved. And then not only that, it's not only the doctors that got involved, but they got involved, the entire community with them. So the whole families were involved, wives and husbands and children, they all participated. They all had become about the big SAMS family. But not even the Syrian community also got involved. Our colleagues, our humanitarian doctors and nurses who got inspired by our work, they got inspired by our results, some of them that Dr. Azuz mentioned, and they got more involved in this. So it became a big phenomenon and a great reputation. And most importantly, it was very, very important in showing what a medical community who is determined to do good work and is capable of doing. And so that's, you know, my proudest days are basically my SAMS days, because I really made me have a focus in my life, and that life-changing experience with SAMS transcends beyond me to many, many, many people, whether young or old, or someone who just started their medical career and went on a SAMS mission, and they found it a life-changing experience. So we, you know, other than the medical relief things, there's few things that we have decided as a community to work on, which is basically to concentrate on providing other services to our members, like research and education and community-based services. So we provide here in Chicago to the disadvantaged community next to us free clinics, and including many specialties like gynecology, cardiology, endocrinology, pulmonary, And that was very well received in our community. And, you know, it's a kind of a payback for all the support we got from our community for all of the, we provided almost 1,000 N95 masks when it's very hard to find to the community, the people, the healthcare provider. We provided them with certificates of appreciation. And then we, as a strategic thinking in SAMS, looking down the line in the future, we want to build up a community of doctors that are not only going to provide medical relief, but will provide education and be part of building the education system in Syria. And also here in the US, we want to really get to mentor many of young doctors so they can go on these missions with us. They can learn the meaning of humanitarian work. So when they come back to their societies, they are better doctors, better physicians. They're helping their community directly. So that's part of the appeal for SAMS. I mean, could go on forever, but I don't want to talk too much. I don't want to take the time of other speakers.
No, that's all right. Thank you, Dr. Mufaddal. And I appreciate you mentioning how much of a family it feels like. It really does feel like the SAMS family, and there are family gatherings and everybody is involved, and it's beautiful to see. But I also remember very clearly at each and every one of the fundraising events that I've been at, there were doctors who were not from the Syrian-American community who had gone on these missions and who had supported. And it was incredible to see how through this kind of life-saving work, you know, the network grows far beyond just the Syrian-American community. So I wanted to just ask you real quick. I know the medical missions have been organized since 2012. Is there something short you can just tell us about the impact of these missions before we watch the overview video?
Well, first of all, the impact is on the volunteer. Every mission changes someone's life. And I have, personally, I had so many situations where it impacted my life forever. And I'll mention my first mission. I went to Syria, inside Syria. That was in 2013. We were in Bab al-Hawa hospital. It was a small hospital as there on the Syrian border. And we were told that we will be receiving casualties within like an hour. And you know, it was true. We got an hour later, we get a lot of casualties. Some of them were wounded civilians and fighters, and some of them really had very bad shrapnel wounds. And I was thinking of talking to myself, saying, what am I doing here? I mean, I'm an oncologist. I don't know how to treat shrapnel wounds. I'm not a surgeon. I was very frustrated. And although my colleagues were working on one of the wounded and trying to help out, and the guy is bleeding, I said, well, let me not waste too much time. Let me talk to the guy in the next cubicle. So I pretended I'm doing something. I started a conversation with the guy in the next cubicle, and I asked him, what are you doing here? He said, well, doctor, I had a car accident last night, and they're keeping me here under observation, and they're ready to send me home, but I don't feel good. So what's wrong? He said, well, I have some abdominal pain. So everybody is busy with the casualties. So I'm looking at the guy and saying, the guy is shocky. He doesn't look right. I check his blood pressure is low. I call in the tech, he gets an ultrasound, and the guy turned out to have a ruptured spleen and he's bleeding. So we call the surgeon immediately. He goes in, he removes his spleen, he saves his life. So here I am, that lesson is, if I wasn't there in that particular, when I thought that I was useless, I'm not doing anything, I was able to save someone's life. So that taught me that I have to be there all the time in these missions, because no matter how difficult the situation is, no matter how desperate the situation is, you still can save one life. And if you end up your mission and your career saving one life, you gained a lot more than 99% of people. So that is the experience that many of our colleagues do when they go on those medical missions. You know, you see people who are totally desperate for a cardiac cath. They get life-saving procedures, life-saving surgeries. People who all of a sudden, somebody who had needed a cornea transplant, and he's blind, and all of a sudden, you know, one of my colleagues calls me and he says, well, I have 3 or 4 corneas. It's Thanksgiving time. No one needs them. If we don't use them, they're gonna expire. Let's go to Lebanon and on a mission. And all of a sudden, this guy gets a call saying, we have a cornea for you. Come and have your surgery done. And actually, all of us in 2 days, a guy turns from blind to someone who can see. All right. Wow. So The guy who did the surgery's name Baha, and the patient's name was Baha. And now, you can look at how the impact of these missions are on the lives of the people who are there. Many, many of them, there's stories I can't really count. But most importantly, those volunteers who come from medical missions, and they start talking about their experience, they attract many, many more volunteers who are willing to have their lives changed by experiencing those missions. But most importantly, also they become advocates for all these people who are experiencing so much injustice and experiencing so much discrimination and have suffered so much. You get someone who's advocate for their rights and call for and ask for their donations. So there is a huge impact on the community and on the recipients, and most importantly on us. We gain a lot more than we give.
Yeah, absolutely. And just simply feeling like you're being seen and you're being heard must mean so much to people. So with that, thank you so much for the recap. And I'd just like to now show our audiences the 2019 overview video of SAMS medical missions. Thank you, Dr. Hamed.
Our work, it was not exclusive only to the Syrian refugees, but for all those who are in need.
We have done over 60 surgeries, and I think that it has been amazing because we have such a team that is invested in providing superior care for a group of individuals that no one else will acknowledge the necessary focus on their gynecologic needs.
والله فضلهم ما أنسى طول عمري، بس الحمد لله الله بعث لي إياهم، والحمد لله الله حن علي ويعني وسويت هالعملية.
The needs of the Syrian refugees are extensive. The need is still there. I almost feel that the need is more dramatic now than it was when I did this 4 years ago. And I guarantee you, if you experience this once, you will never stop coming.
Yeah, so far every single case we've done today, if we did not do it, it would not have been done. So this is a life-saving work that SAMS does.
As you can see, this is truly life-saving work that has an impact on not just the people who are receiving this aid and this assistance, but also the people who are giving it. And so thank you again to all of the SAMS medical professionals and volunteers. I have to say it one more time. To donate, text SOS for Syria to 91999. And to view the annual report, make sure you go to sams-usa.net. Now, as Dr. Mufaddal had mentioned, SAMS also launched a student chapter to talk about this initiative and how medical and health professional students can get involved. Dania is a registered nurse, United Nations representative, and family nurse practitioner student. She has been volunteering with SAMS for over 4 years. Welcome, Dania. Thank you for being with us.
Thank you, Omar, for having me. It's been an amazing experience being here. So like you said, in May 2019, SAMS launched its first ever student chapter in Southern California. I was fortunate enough to be one of the founding members. The chapter is based out in, sorry, my little cousin just walked in. He's like 1 year old, so I can't explain to him what's going on. But we worked closely with SAMS, our professional chapter, working on planning health fairs, as well as many kind of recruitment activities in campuses within Southern California. We organized shadow opportunities for students. I do know that also in Florida, they launched a chapter, as well as where Dr. Mufaddal is in the Midwest chapter. So that's been great. And I know they also established the first ever free clinic there. So overall, it's been a really, really great experience. Sorry, guys. It was so quiet before, and now it's like everybody. You guys understand.
Wonderful. And do you have any advice for any young students who are interested in learning more or being a part of it?
Honestly, for me, I feel like everything that I am today is because of SAMS. So the first medical mission trip I ever went on, or any kind of volunteering experience, I was 19 years old. I had just started nursing school. I went down as a translator. And the experiences that I had down there really defined who I wanted to be as a nurse, as a mentor, as a daughter, and as most importantly, as a human being. So currently right now I'm pursuing my family nurse practitioner, so advanced education in nursing, because I want to give back to SAMS for all the things that they've given me. So I really, really am so proud of SAMS for establishing a student chapter, because our future is our youth. So I'm really happy that they're investing in them and giving them an opportunity to be a part of such an extraordinary organization. I know this past conference that they had in Orlando back in February, they had over 40 students that they sponsored to be in attendance. And that gave me so much hope, because those are the people that are going to be learning from people like Dr. Mufaddal or Dr. Mahid to learn to how to run such a phenomenal organization and be part of it. So for me, I honestly, like, my whole entire life is because of SAMS. It's just why I've been a volunteer, and why I'm so actively involved is because the hope and the hope and the passion and love that I saw in little kids' eyes on mission trips inspired me to be the best version of myself. So, yeah.
That's beautiful. Thank you so much for sharing that reflection. And inshallah, one day your little nephew can also be a part of SAM. Did you say nephew or cousin? Yeah, can be a part of the SAM.
Cousin, yeah.
Yeah.
He kept like ringing the doorbell like 5 times, and I was like, oh
no. All right. Well, thank you, Dania. Have a wonderful night.
Thanks for having me.
And next up, it is my honor to introduce our next speaker, Sami Zayn, who is a Syrian-Canadian professional wrestler currently signed to WWE. And in partnership with SAMS, Sami Zayn launched the Sami for Syria campaign to support mobile clinics in parts of Syria to provide quality, dignified care to highlight vulnerable individuals. He recently launched a mobile clinic in Northwest Syria thanks to the support of his fan base. Sami, welcome. Thank you for being with us tonight.
Yeah, thanks so much for having me. It's an honor.
Of course, of course. And just wanted to ask you, what made you want to get involved with SAMS?
Well, I guess I had just reached a point in my life, just doing some introspection, and obviously being of Syrian descent and growing up in a Syrian household. At that point, the war in Syria was several years in, and of course it broke my heart. But I just came to the point in my life where I realized, a bleeding heart, it's something, but it doesn't really do a whole lot. And I really realized, as much as I want to talk about how awful things are, I really don't do anything about it. So I kind of had this new clarity and this new perspective about wanting to get involved, but it's just such a daunting thing, because you feel kind of powerless to help something so big as a war, which, not even a war in your backyard. We're talking a war overseas. in a very complicated area. You don't even know where to begin, where to end. So it seemed very overwhelming. And my brother, he's something of an activist, and here in Canada, over in Toronto, and he's actually worked helping bring refugees into the country, and got some of my family actually who was escaping the war into Canada as refugees in Toronto. So I kind of asked him, hey, what organizations would you recommend for me to do something here in the States, living in Florida at the time? And he referred me to a couple, and SAMS is one that kind of jumped out at me because, it was very hard to find an organization that was doing something on the ground in Syria. So it just seemed, there were tons of groups doing a lot of extraordinary work, but they just seemed a little less accessible to me, where it was very hard to understand, even if I committed to their cause or whatever, what my role in it could really be. Whereas with SAMS, it really seemed very direct, like, hey, they are on the ground helping on the front lines. So that's really what drew me to SAMS as an organization above all else.
That's awesome, man. Thank you so much for sharing that reflection, and thanks to your brother for putting you on to SAMS.
Yeah.
On that note, if you could tell us just a little bit more about your collaboration with SAMS, like why you wanted to focus specifically on supporting mobile clinics.
Well, once again, it was a little overwhelming. Even once I finally said, "Oh, SAMS, well, this one seems to really connect with me." Even then, as was touched upon throughout this this virtual webinar we've got going on here, SAMS does a lot. And then it became the question of, all right, well, I know I want to work with this organization, but where do I begin here? Because they do so much. And then you get into a really, messy train of thought where it's like, well, who needs the help the most? And that's a really messed up question, because everybody's suffering. And you can't really put a value on, well, these people are suffering less than these people. It's just, there's a lot of suffering. And you can't really, it's just a hard decision to make. And so the first thing that jumped out at me was with the medical missions. And that was something I was really interested in. And then at that time, I think it was when these attacks on healthcare providers and hospitals started to become commonplace. And something just clicked when all of a sudden I heard about this concept of mobile clinics, that, it's bad enough these people are stranded in Syria, and it's bad enough that they're living through a horrific war. And now they can't even get medical care because it's dangerous for them to go, because they could go to a hospital, but they're risking their life to go to a hospital. So now all of a sudden this concept of delivering care to them directly, especially if they've been displaced or they've been bombed out of their homes, or if they're living in rural areas where there is no access to medical care. So it was a bit of a light bulb. I was like, this is it. This is the one. This is perfect. And then, so the mobile clinic thing really jumped out at me. And initially I had the idea to maybe just donate, do a donation anonymously, and that's it. But then I really got to thinking, and I was inspired by, I'm a Montrealer, and there's a Montreal hockey player here named PK Subban. I don't know if you've heard of him, but he was really, really popular in Montreal. And one of the things that really endeared him to the city is he pledged some crazy amount, which I forget at the moment off the top of my head, but it was something like $10 million to the Children's Hospital. And it floored me. And it floored a lot of people in the city, like this generosity. And I just remember feeling so inspired by that I wanted to, pass that along and create awareness and advocacy, and not just, one charitable donation. And then I could walk along my way and say, well, I contributed something, and move on. And I'm really glad that I went that way, because I think we were able to accomplish so much more collectively than I ever would have been able to accomplish with one donation. Because look, I'm not Bill Gates. I'm not Jeff Bezos. I do okay. I make a living, but I'm not, I can't change the world. I don't have world changing money. So, I could have done one donation, but then I realized there's just so much more strength in coming together collectively as a community, and to spread this message also to the wrestling community, which doesn't really have a vested interest, say, in, something as abstract as a war in Syria, they might not have a personal connection to that. And I don't fault anybody for that. There's a lot of things going on in the world. Not everybody's connected to everything. But I think drawing people into this issue and into this cause, and not just financially was amazing, because it helped us raise enough money to do these things, like to launch the first mobile clinic in 2017, which ran for a full year and provided nearly 11,000 medical services. So that's way more than I could have done on my own. And that's something that we did collectively by bringing people into the conversation that normally wouldn't have been involved. So, I'm really glad that I went that way. I'm really just touched by the generosity of wrestling fans that don't really know about SAMS or don't really know about Syria, but still felt that it is a good cause and donated their hard-earned money. That really, that really gets me. That means a lot to me. And it's really, really remarkable what we've been able to do. And again, I wouldn't have been, SAMS is doing all the legwork. They're doing all the grunt work. Their doctors in the field are doing the real life-saving work. So I just feel like at least I'm honored to even be a small part of it in the middle as a middleman, bridging, raising some funds and allowing them to do their life-saving work. So the whole experience has been really, really wonderful.
Amen. Well, thank you so much, Sami. From the bottom of my Syrian-American heart, thank you. And I also, I know you regularly used your platform even before Syria to speak to social justice issues. And so I think the fact that you do that, and then you also tied it into your own heritage, it's just a beautiful thing, man. So thank you for doing what you do. And thank you, like you said, to all your fans also who supported. And with that, I'm really honored to be able to introduce our next speaker. And also, just before that, once again, thank you to Sami. Thank you to all of your supporters who've supported SAMS over the years and the beneficiaries. Definitely appreciate it. But this next speaker is actually in Syria. And this is an honor for me to be introducing to you all Dr. Farida Almouslem, who is the director of the SAMS-supported Adana Maternity Hospital. Now, Dr. Farida was the last remaining female obstetrician in besieged East Aleppo. Originally from Aleppo, she studied at Aleppo University and worked primarily at the largest trauma facility in East Aleppo, nicknamed M2. And during the siege, she performed surgeries under extreme conditions, delivering babies with no electricity, successfully completing a cesarean section, even as aerial bombardment sent pieces of the hospital's crumbling ceiling into her patient's abdomen. Dr. Farida played an instrumental role in training midwives and nurses in response to the shortage of medical personnel in the besieged city, and she is currently the coordinator for the newly established SAMS OBGYN committee, as well as the instructor at the SAMS midwifery school in Idlib. Dr. Farida, thank you so much for being with us. I know it's very early in Syria.
Thank you, Omar. It's 4 a.m.
4 a.m.
Yeah.
Hopefully you have your coffee now.
Yeah.
So I just wanted to ask you, I know the escalation in April 2019 was unprecedented, from systematic attacks on healthcare to waves of displacement. Can you just tell us how you managed to keep going and ensure that civilians had access to care?
In these cases, we just follow the people. We move our hospitals to the places where the people now is focused in these areas. So when there was a heavy bombardment on rural Hama, and when there was a heavy bombardment on southern Idlib, we just moved that hospitals in that area, but they are already just bombed. So we had to move. We just follow the waves of these people. Many of these people now were concentrated in next to the borders, like in Adana, in Sarmada, and many of these people focused in northern Aleppo, whereas now now it's my job. Now I'm in Azaz. There is a new hospital to SAMS. It's called Sejja Hospital. It's newly established to SAMS, and it's a new project. SAMS always making a new projects, following the people, following these waves of people. And that's very, very important, because when there is a heavy bombardment for any area, this area just be empty from civilians. Even though the regime always take these places, the fields are shrinking, but the number of people are not shrinking the same as the fields. So the amount of people just focused in smaller areas, and so we need to establish new hospitals into that area. So we make Adana Hospital, and now there is Sijja Hospital. There is many new hospitals, but I just want to talk about the bombardment, what's happening on the hospitals. It's very bad to be on the hospital and to have been bombarded in the hospital. Last, when I was in Al Atarif Hospital and it had been bombed in February, I recalled all the memories in Aleppo. I just was afraid, and I lost my bravery. I thought I should go home, but really I should stay. I have to stay, but I can't. I'm a human. That's what's happening on the real world. So now we had the new projects in all the area, and we moved that projects from that areas which had been bombed, which had been taken by the regime, and now we had the new projects in northern Aleppo and in next to the borders, next to the Turkish borders. Also, we made with SAMS, with the cooperation with SAMS, training institutes for midwives and also for residents. And this is a very great project because you are doing your job for future, not just for this time. So there is now midwives, enough numbers of midwives, but the numbers of doctors are always, there is a short of doctors, always. So I had to stay in Syria. So that's it.
Thank you so much for telling us. I can't imagine what you're going through. And to hear you say that you think you lost your bravery, that broke my heart, because I can't think of anybody more brave that I've had the opportunity to speak with. So Dr. Farida, thank you so much for all of your sacrifices. And to all of the medical professionals in Syria, please relay our deepest, deepest thanks and gratitude. I just wanted to ask you one more question, if you don't mind. What's the situation like in Northwest Syria today in terms of the cross-border authorization and now, of course, with COVID-19?
The situation is very bad. That's the truth. The people here just live in camps. The camps are not organized. There's no infrastructure in this area. Since 1 or 2 months, there was a patient came to the hospital. She was holding her 3-year-old baby. She was dead. Her baby was dead. The baby was just walking in front of her tent, and she just dropped in a drainage hole. There is no system for draining, and she lost her daughter. She was crying. She didn't believe that her daughter is dead. All the staff in the hospital cried with her, and she was crying. She was her only daughter. The situation, there's no schools, no structure, no the hospitals is in some camps. The hospitals are far away from that camp, so the people we had to find any way to have transportation to that hospital, and there's no public transportations. So many cases of women who had been still dying in their homes during delivery because they don't have close hospital to their homes, and they don't have transportation. So we still see many cases of this is still happening until now. And also the situation is worse now because of COVID-19. Until now, there is 12 cases of COVID-19 in northern Syria, between northern Aleppo and north Idlib, next to the borders. It started with one doctor who had entered from Turkey to Syria, and he had COVID-19. And unfortunately, he had 3 doctors also had infected. And now we had 12 cases of COVID-19 in Idlib. And the big problem that the number of isolation ICU is not enough, but SAMS helped to make a center for isolation, and there is I think 22 beds of isolation ICU, and SAMS made it in Idlib, the city. But the problem that in Syria, the isolation is luxury. If you are living in a tent with 25 persons, no way to isolate yourself. No, no solution for this. One day, one patient came to me. She said, "I'm depressed. I want to kill myself. Just want to die." I asked her why. She said, "Because I had no privacy. I live with 30 persons in just 2 rooms. I don't have place to read. I don't have place to relax." So she was feeling depression, and she was depressed for the 3rd degree. I sent her to a psychiatrist, but there's no solution. Whenever this patient had the same situation, the same circumstances, the same place she lives, I think that there is no solution for this. Not her had the depression. Many of people in Idlib is depressed. Many of them lost their homes. Lots of them lost their dignity. Many of them was wealthy people, was living in their home, having their fields. Now they lost everything. Then when the escalation in 2019. And now this is the situation, and many of these people depending 100% on the aids which coming from the crossing border from Bab al Hawa. If this crossing border had been closed, many of these people have nothing. Many of them just depends on that food basket. Many of them just depend on that sanitary basket. Many of them just depend on medical health, medical aids which come to them to that hospital, and just they receive them from that hospital. If that cross border closed, everything will be closed on front of this, and the face of these people. So I can't imagine the amount of this disaster if it happened, that if they close the borders, because we now is living in a big besiegement in Idlib. It's big besiegement. We don't have most of the people don't have a way to go to Turkey and don't have a way to go to the regime area. So we just under besiegement. If they close that way, nothing. We can't do nothing. People just waiting death. And yesterday there was a bombardment from Russian airplanes on Al-Bab city. It's in northern Aleppo. And people was surprised. They think that the escalation is still going on, but there was a surprise for everyone. And the people were just feeling bad about that. Many of people had died. It's in Al-Bab city. That is still going on until now. I can't trust the regime and Russia. Also, the people here just can't trust them. We hope that the situation is not going in more worse than this. But COVID-19 now, with 12 cases in this area, is very bad. We are expecting, if there was 1 case, it will be a disaster. Now there are 12, and we are just expecting more cases. I hope that's not happening, because the number of, as I mentioned, the number of beds is not enough for ICU beds, and no isolation centers, and it's luxury. To be isolated is luxury. Thank you.
I can't even imagine. I mean, it's hard enough just dealing with COVID, let alone dealing with COVID and the bombing and the overcrowded situations and the trauma of the decade already. So just, I have to say thank you again from the bottom of my Syrian-American heart for doing what you do, for staying and for being a part of the fabric of society there and contributing in such a meaningful way. Ya'tiki alf afiyah. I wish there was more we could do, but I want everybody who's watching now to remember that you can donate by texting SOS for Syria to 91999. You just heard very clearly how dire the situation is and how important your contributions can be. Taking it back to the very first thing that Dr. Azuz said about mental health, and considering what Dr. Farida just said about the sort of depression that's happening, and taking taking root in people's lives. You know, it's really important to understand just how holistic the sort of support that SAMS provides is, and how necessary it is. So once again, thank you to Dr. Farida. Thank you to all of the doctors who've spoken. Thank you to Sami Zayn. Thank you to Danya. And most importantly, thank you to all of the participants who've been joining us across the country and across the world, indeed. I'm going to make one last plug about the annual report. You can find out more about it at www.sams-usa.net. Find out about all the life-saving work that SAMS was able to support in 2019. And I wanted to just bring it back to where we had started, actually. I began this with a poem. I'd like to end it with a song in honor of my father, may he rest in peace, Abdul Latif al-Shaqaqi, who had immigrated here in the 80s and helped bring many of our family members from Hama and from Damascus to the United States, many of whom ended up becoming doctors. Some of them are actually a part of SAMS now. But this is more than just a eulogy to him. This is a tribute to all of the fathers who made these incredible sacrifices over the years. This is a tribute to anybody who's lost a loved one. The main message in the song is Inna lillah wa inna ilayhi raji'un, to the one we belong and to the one we all return. And it's meant to remind us of that cycle of life. And you know, I think back on when my father had passed away, which was actually just 1 year after we had become citizens here in the United States. You know, ironically, coincidentally, tragically. I was about 12 years old at the time, and I remember that my sister had also just given birth quite recently to my nephew, her son. And in between the mourning of the men and women who were, you know, mourning and crying, you could also hear the babies crying as well. And so, you know, I imagine a lot of that has been happening in Syria over these last 10 years. And again, I dedicate this to anybody who's facing the reality of what our own mortality looks like and feels like. So this is called Close My Eyes, and it is how we are going to close out this event this evening. I want to thank all of the donors and all of the participants once again. My name is Omar Offendum, and this one is called Close My Eyes.
I close my eyes. I see you now.
I close my eyes and I see you now.
I close my eyes. I see you now.
I see you now. I bet you thought that I'd forget. I'll admit I've often tried. Ever since the day you left, I've been feeling lost inside, waiting here with bated breath. Patiently I recollect, 1 foot in the grave, foolish step to take. Now wait a sec, I heard about it all before. Read it in the ancient text messages delivered from the best of us to save the rest of us from grief, stress, and the weak chest, speechless. 1 tongue, 2 eardrums, so speak less. And yes, the meek blessed with inheriting this earth. But until then, I worry for children who perish first, carrying thirst, walking miles for polluted water, buried in turf, lost smiles in a slew of martyrs. Is this the type of life we're meant to be living, where history's repeated, tragedies we're reliving, huh? These were the kinds of conversations that we used to have, but now that you're gone, I just speak to you in song, and I close my eyes. And I think about the hundreds of thousands of Syrian lives lost over the last decade. I close my eyes. I think about the millions of families torn apart and displaced over the last decade. And I know I have an act for showing up soon as I close my eyelids. The world is black, but sure enough, your luminance is shining. They say no man's an island, and to me, you were a continent, constantly reminding me to elevate my consciousness. Now back when I was growing up, you told me to keep smiling, that no matter what the obstacle, nothing was impossible. Timeless wisdom in your silence, a language all its own. Find a place your children love and go on and call it home, and plant roots and watch your family tree grow to bear fruits. Can't let that pride in ye grow. Set aside your ego. In the eyes of people, we share truth. Clear through windows to your soul center. So find an equal whom you love being alone with to get you through the cold winter. The type of guidance you provided me was priceless. I can almost see you smiling while I write this at night. I close my eyes. I think of all the medical professionals who've lost their lives trying to save the lives of others. I close my eyes. I think of all the beautiful Syrian children longing for a better day and a better way. I know grieving isn't easy, but the tears breed patience. Believing isn't easy, but the fears feed faith in that infinite uncertainty of certain situations. Recognize you're immortal. Your demise is but a portal to surprises unpredicted by the limits of a mind so finite that only in hindsight do we ever find what's right and what was wrong. And this is more than just a song. Sometimes your heart must skip a beat so you'll appreciate it more. And I keep calm and carry on. You want to knock on heaven's door, I'm not so sure. Brother, the line is very long and since his very dawn, mankind has never been benevolent enough to get along, at least not on a global scale, so please begin at home. I pray without a total fail, but indeed the good die young. Deep inside, I know we'll be united very soon. That's why I say, Inna lillahi wa inna ilayhi raji'un. Indeed. To the one we belong, and to the one we all return, for as sure as the sun will burn. You'll learn. You'll learn. That to the one we belong, and to the one we all return. Khalil Gibran said, I have seen a face with 1,000 countenances, and I have seen a face that was but a single countenance as if held in a mold. I have seen a face whose sheen I could look through to the ugliness beneath. And I have seen a face whose sheen I had to lift to see how beautiful it was. I have seen an old face much lined with nothing, and a smooth face in which all things were graven. I know faces, because I look through the fabric my own eye weaves and behold the reality beneath. Ladies and gentlemen, fathers and mothers, sisters and brothers, family and friends, thank you for joining us during the Syrian-American Medical Society 2019 Annual Report Launch event. I want to thank all of the panelists once again, thank all of the attendees, and of course, all of the donors. One more time, to donate, text SOS for Syria to 91999, and to view the annual report, go to www.sams-usa.net. My name is Omar Offendum. Have a wonderful evening. Peace.